Hey everyone, so in this video we're going to cover the mid-sagittal head, so this is page 55 in your book. It is dense, so be prepared for that. Hopefully you can see all this information in that video, but we'll zoom in, we'll look at it, so let's dive in. Let's first cover the letters, then I'll get rid of them, just so we can see other things a little bit more clearly. So we've got the cranial cavity up here, uh, where that frontal lobe sits. Is where the A is sitting. So I think we should know that one. And then B is our nasal cavity. If you look at this, you know, your nose, your inferior, middle, and superior nasal concha is right there. And let's see, B is going to be that nasal cavity like we said. And then this one right here between your nasal cavity and your nasal pharynx, that split is right here. It's number 24, kind of skipping ahead, at tubercle salivary gland. That's going to be in both B and D. Kind of a trick question, but it's going to sit in the nasal cavity and in the nasal pharynx. So, get rid of that. There goes that line separating that nasal pharynx and that oral pharynx. So E sits back here, behind the tongue, and behind your set of tonsils back up in here. And then F is that laryngopharynx sitting down past that oral pharynx that sits in there. And then if we keep going down on this left side, you're going to hit your esophagus. Alright, and then C, I hope you understand where this one is. If not, you might be in trouble, but that is your oral cavity sitting right there, and here's your teeth. Alright, now let's go through the numbers, make sure I get them all. So number 1 is going to be your hard palate, right there. And then number 2 is going to be your soft palate. Number 3 is going to be your hyoid bone, which is going to be down here. This is a pretty cool bone. So it's free floating. Um, it you can actually feel it, and you can kind of move it a little bit. But you have a lot of muscles that connect to this, and we'll get into that pretty intensely in the next couple of videos. But hyoid bone, number 4, mandible. We already knew that one. Coming off of the back of the mandible, you have to draw these in, but these are called mental spines. Number 5, that's going to be your thyroid cartilage. So you're going to have your hyoid bone, and then you're going to have thyroid cartilage right here. And in between the two is going to be your thyrohyoid membrane. Okay? You're going to get all of these different terms down through here. So, if you're going to combine like the membrane between two things, a lot of these terms you'll see will throw like an O between the two. So you'll see here in a second. So, thyrohyoid membrane. It's going to be your thyroid cartilage. And then right here in gray, I guess that was a bad color to choose. That's going to be your cricoid membrane. Now it's going to be your cricothyroid membrane in between those. And then your thyroid gland will be sitting down right here. All right. Number 6 That's going to be your larynx, sitting right here. Number 7 is going to be your epiglottis. You'll want to write down in there, it closes when food comes down automatically. So you ever like breathe while you're drinking water and it feels like you've got water down in your lungs? Yeah, it's because you're breathing, so your epiglottis is open, then you were chugging the water, and then all of a sudden water ends down the tube, wrong tube. um, where number 6 is, right here around the edges, that's where your vocal cords are. Number 8 is gonna be where your trachea starts. As soon as you pass through there, trachea, you'll get these, looks like tracheal rings. Look on the complete anatomy, or even go to your lab and look at it and feel it. It is like you'll feel the rings, be able to just feel the different like texture through that trachea, which is kind of cool. Number 9, you're actually going to come back up towards that nasopharynx. That's your eustachian tube. I think we talked about it from page 57 that I've already covered, talking about just like that airway that comes from your ear into this cavity. It'll like pop. You get that popping feeling from it when you going really high in an elevator or flying. That allows your body to regulate the pressure in that ear canal. Number 10, again, superior nasal concha. 11, middle. 12, inferior nasal concha. 13, we already covered. It's those mental spines. 14, that genio. Again, genio, O, hyoid muscle. So 14 is this one right here. And you can see in your picture, like the fibers of this muscle are going posterior to anterior, anterior to posterior. And then 16, we'll look at this one first. That's your mylohyoid muscle. And this is going side to side, from left to right. That's where the muscle fibers are going. That's why it looks different in texture in your book. And you'll be able to see that here in a couple of pages. You'll be actually able to see why it has that kind of texture and why it's running lateral. 15, genioglossus muscle. And back here, here's one of your tonsils. That's number 22, your lingual tonsils. It sits right behind your tongue. 17, we covered that. That's your esophagus. 18 is your frontal sinus. Talked about that so many times. 19, sphenoid sinus. Hopefully you remember what 20 is. So tertica, what sits in it. Pituitary, what comes out of it. Progesterone, estrogen, and testosterone, right? 21, that's going to be your palatine tonsil. We already talked about this one. Well, that's the one that we're talking about. That's your palatine. What's this one again? Your lingual tonsil, right? 23 is pharyngeal tonsil. And we talked about this one right in that nasal cavity earlier. What was it? Tubercle salivary gland, right? Number 23, 21, and 22, they are all considered part of Waldear's ring. You ever hear that term? It's talking about all your tonsils all together. So that should be it for this video. This one's might be a little hard to do in complete anatomy. I'll try and make a video for it. So please look out for it if you're still a little confused. But I think that's it for this video. So we'll see you in the next one. Alright, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.